One fascinating patient that I've been following for the past several months is a young girl with Crohn's disease. Crohn's is a form of inflammatory bowel disease. Their initial reason, or the parents' initial reason for coming to me was, number one, her disease was not controlled. She had poor appetite. She still had blood in her stools. Her disease or her inflammatory markers were still elevated. And she was already on steroids. And the pediatric gastroenterologist was actually thinking of adding a second and third additional disease-modifying agent, which has a lot of potential side effects. So the parents were seeking alternative sources. So we met. We talked about our goals. That's the most important thing that anybody tells me, is what's their goal, because that's what we focus on. And their hope was that she can come off steroids or never have steroids. And of course, they really just wanted her disease to be controlled. So in a matter of 4 weeks, she went from having a mildly elevated inflammatory marker called ESR and CRP. She was able to get that lowered towards normal. Number two, over those next 4 weeks, we were able to wean her steroids by 10 milligrams each week by her gastroenterologist. That was being done by her. And then after 2 months total, she had no inflammation in terms of her inflammatory markers. Her steroids were just about off. She still had a little bit of blood in her stools, but she had gained weight because she was eating better, and she was sleeping better. So 3 of the 4 things in her disease that were not controlled, with solely by adding cannabidiol or CBD, she was able to almost be off steroids, gain weight, have no inflammation, and she was happy, and the parents were happy. So the most fascinating thing for me, of course, is that we were able to do this together. But the most important, or next most important thing, which is always important every patient that I see, is communication with their primary care doctor. And so we were able to work together with her gastroenterologist, who also was very open to discussions about the endocannabinoid system, and integrate cannabidiol or CBD into her therapy, and of course have good results. A perfect example of this is also a patient this patient does not need a medical marijuana card. In general, we can get good CBD from a good company that's reputable and very well tested, and start them on CBD either while waiting for a card, or if they don't want to get a card or are not interested at using it at that point. So there are options of still getting disease modification, disease help, or symptom help without having a medical marijuana card. Now, some of these people will benefit from adding THC to their repertoire, or their ingredients, if you want to call it. And then we would have discussions, or either they have the card and we can now implement it, or we can then go through with getting a card if they qualify, and going from there.